Good afternoon, everyone, and welcome to today's webinar, hosted by the American Academy of Pediatrics and HealthyChildren.org. Today we're discussing gut health for kids, why it's important, and ways to improve it. A few pieces of housekeeping before we begin. This webinar is being recorded, so if you lose connectivity for any reason, you'll be able to watch and listen to the archived webinar in about a week or two. If we can help you in any way with technical issues during the webinar, please use the chat function to send us a message. We will have time at the end of the webinar for a question and answer session. To ask a question, please use the chat function. You can activate chat by clicking on the speech bubble at the bottom center of your screen or the person-shaped icon for mobile users. You can send in your questions at any time and Dr. Shu will get to as many as she can at the end of the presentation. We would now like to introduce our hosts, Dr. Jennifer Shu. Dr. Shu is the medical editor of HealthyChildren.org, as well as a practicing pediatrician, author, and mom in Atlanta. She's also co-author of Heading Home with Your Newborn and Food Fights. She's a frequent guest on national and local television, radio, and web-based programs. She served as the Living Well health expert for CNN.com, has contributed medical information to Baby Center and WebMD, and serves on the Parents Magazine Advisory Board. Welcome, Dr. Shu.
Thank you so much. I am really glad to be talking to all of you today about everything there is to know about gut health in kids and why it's so important. I'm also happy to be joined by our guest expert, Dr. Christine Waasdorp Hurtado. Dr. Waasdorp is the medical director of the gastroenterology team at Children's Hospital Colorado in Colorado Springs. She has received several awards for patient satisfaction, including the Colorado Springs Top Doc Award. She has also developed a nationwide program for pediatric gastroenterology fellows on gastrointestinal physiology and is passionate about educating patients, parents, and future providers. Thank you for being here, Dr. Waasdorp.
Thank you for having me.
We'll go to the next slide first. Our first question is, tell us a little bit, how does gut health affect the digestive system and overall development in kids?
Can we go back a slide and talk about, start with why good nutrition and gut health are important together?
There we go. Sorry, I fast forwarded. That'll look good on the recording. First question is, why are good nutrition and gut health important?
Perfect. It's a great place to start, and we will definitely get to all the other questions. So good nutrition means eating a healthy, balanced diet that gives your body all the nutrition it needs to function at its very best. Good nutrition is important for kids and teens because it supports their growth and development. That right balance of nutrients also lowers the risk of developing certain health conditions later in life, such as obesity, heart disease, type 2 diabetes, and cancer. So when we talk about nutrients, we're really talking about water, proteins, vitamins, minerals, carbohydrates, and fats. The nutrients we consume are broken down by the GI system, or the digestive tract, which is a 30-foot long twisty tube that goes all the way from our mouth down to our anus. It includes your mouth, esophagus, stomach, small intestines, and large intestines, which is also known as your colon. When we refer to gut health, we're talking about that entire GI tract and how well it works to process the nutrients as well as get rid of the waste. We also are talking about how balanced the bacteria that live inside of our intestines are. In a healthy gut, there are trillions of bacteria that help with digestion, as well as producing other chemicals that are important to keep a healthy immune system and healthy brain functioning. We'll talk about that balance a little bit later on. There are a variety of factors that can impact gut health. These include age, other health conditions, genetics, stress, nutrition, environment, medications, and your diet, which we'll spend quite a bit of time talking about today.
Okay, so next let's talk about how does gut health affect the digestive system and overall development in kids.
Perfect. So your gut breaks down the food so that the nutrients it contains can get to the rest of your body through the bloodstream. A healthy gut helps your child get the most nutrition out of everything that they eat. When gut health isn't optimal, that can lead to digestive issues such as constipation, diarrhea, nausea, gas, bloating, acid reflux, and potentially abdominal pain, or many of those symptoms altogether. An imbalance of the bacteria in the gut has also been linked to many other conditions that include inflammatory bowel disease, obesity, anxiety and depression, type 2 diabetes, heart disease, respiratory disease, and allergies. Kids who have an autoimmune disorder called celiac disease have trouble absorbing nutrients because of the inflammation that damages their intestines. That's their response to gluten. This damage does resolve on a gluten-free diet. Unfortunately, the gluten-free diet often does not have adequate iron, calcium, vitamin D, folic acid, and zinc, all substances that are added or fortified in gluten-containing foods, particularly bread. Other health conditions, such as Crohn's disease, which is an inflammatory bowel disease, and cystic fibrosis, can also impair digestion and make it difficult for children to absorb all the nutrients they need to be healthy. But what your child eats does have a major effect on what kinds of bacteria inhabit their gut. Keep on going, huh? So, because of this, the nutrition that your children eats in the first 1,000 days of life may be the most important when it comes to establishing their gut health for the future. Experts think that because nutrition impacts the variety of bacteria in the gut, many of the diseases that are associated with an imbalance in the gut bacteria may be programmed during this time. But they also believe that quality nutrition promotes a balanced and healthy bacteria in the gut during the first 3 years may help prevent those diseases later on in life. We also know that antibiotic exposure in the first years of life can greatly impact the gut bacteria and should be avoided whenever possible.
Thank you for that. So let's talk next. How does good gut health and nutrition affect kids' brains?
Great question. So we know that there's a direct connection between our brains and our GI system. That's called the gut-brain axis. This connection enables your brain to communicate with your gut and the bacteria that live there, or the microbiome, and vice versa. For example, when your stomach is upset, it can communicate that to your brain. When your brain is anxious or stressed, it can also communicate that to your GI system. This means that you might have an upset stomach because you feel anxious, or you might feel anxious because you have an upset stomach. I think we've all experienced that. In other words, your gut and your brain may have the ability to influence each other, so that when your child is stressed, this could actually affect their GI tract, but it also affects the gut bacteria that live there. There's a lot of ongoing research on exactly how the gut impacts kids' brains, both physically and mentally. Nutrition has a critical role in that lifelong mental health goal and how children's brains develop during the first 1,000 days of life. Brain development starts during pregnancy when the baby is in utero, and by the time your child is around 2 years old, the structural foundations that have been built are what will be there for the rest of their lives. They just continue to grow and develop. Along with a healthy, loving, and nurturing environment, kids need certain nutrients to help their brains develop well. These vital nutrients include protein, zinc, iron, choline, folate, iodine, and then vitamins A, D, B6, and B12, along with omega-3 fatty acids. For kids and teens, encourage foods that support that great brain function, memory, and concentration. Some of the brain-boosting foods that we know of are eggs, fish, whole grains, green vegetables, nuts, and berries.
Excellent. Let's talk now about the importance of a healthy gut microbiome.
Great. The microbiome is made up of the microscopic organisms called microbes or microbiota, mostly bacteria, but also fungi and less commonly parasites and viruses that live inside of our bodies. Most of these microbes, somewhere around 100 trillion of them, live inside of our gut. In adults, this gut bacteria can weigh 3 to 5 pounds, so it's a lot of little bacteria. Our gut microbiome plays a big part in how our immune system functions. In fact, our gut contains 70% of the immune system. This is part of why scientists are finding that our diet can really affect and impact our health. Everyone has their own unique microbiome. We are born with certain microbes that are determined by our DNA, and we pick up all the others along the way from our environment as well as from the food that we eat. For instance, research has found that babies that are delivered vaginally have a more diverse microbiome than those delivered via C-section. This is because bacteria pass from the mother's body during passage through the birth canal. Breastfeeding also seems to help establish a healthy gut microbiome because breast milk contains live bacteria that may be transferred to the baby's gut. Breast milk also has prebiotics that support a healthy microbiome. And it's important to note that many formulas also now have prebiotics added to them. People with a healthy microbiome have many different varieties of microbes, while those whose microbiome is unhealthy have less diversity. What we eat influences the diversity of the microbes in our gut. This is why eating a variety of healthy foods is so important. It helps to create the diverse community of microbes that we need. Fiber is especially important for gut health. Research has shown that a high fiber diet leads to a more diverse gut microbiome and increases the number of beneficial bacteria. Digestion of the fiber creates nutrients that support healthy guts and a healthy microbiome. But it's important to note too much fiber can cause gas and abdominal discomfort. You can help your child's gut microbiome be healthy by making sure they eat a healthy diet. This includes a variety of fruits and vegetables, whole grains and nuts. The more color that you can get onto their plate, the better their microbiome will do. It may also boost your child's gut health to limit sugars, fried foods, red and processed meats, and dairy. Too much dairy can fill kids up and limit their interest and ability to eat a variety of foods and not get the well-balanced diet that we want them to have. So the goal for cow's milk is 18, or any milk, because we have so many kinds now. The goal is 18 to 24 ounces of milk as their primary source of calcium and vitamin D. It's also important to make sure that your child is getting enough sleep, staying well hydrated, and getting lots of exercise every day too.
Let's talk a little bit about antibiotics in the gut.
Great. Again, antibiotics can kill good bacteria in the gut along with the bad. So make sure your child only takes them when they're really necessary. When a child's gut microbiome gets out of balance from taking antibiotics, your doctor may suggest adding more probiotics to their diet. Many fermented foods contain probiotics. Some examples include yogurt or kefir, which is a yogurt-like beverage, sauerkraut and pickles, but it's important that those pickles be raw and refrigerated and not the shelf-stable kind. Kimchi, which is a fermented spicy and non-spicy cabbage, tempeh, and miso, which are made from fermented soybeans. All of these can provide a nourishing environment in which healthful bacteria thrive and release an important byproduct, short-chain fatty acids, that support both the microbiome as well as healthy intestinal tissue. Another fermented food is kombucha. It's a fizzy beverage made with fermented sweetened tea, and it contains probiotics. But it can be risky for children since it contains a varying amount of alcohol. Children, especially if they have a health condition that weakens their immune system, should not drink home-brewed kombucha because it may be contaminated with harmful bacteria. Before you try giving your child kombucha, it's a good idea to talk to your pediatrician and start with small amounts, no more than 4 ounces per day.
Let's talk now about the difference between prebiotics and probiotics.
It's super important to understand that difference. So prebiotics are supplements or foods that contain a non-digestible food ingredient that stimulates the favorable growth and or activity of the friendly bacteria naturally found in the gut. It's kind of like the fertilizer for your microbiome. Human milk contains substantial quantities of prebiotics. There is a paucity of randomized controlled trials looking at prebiotics in children, although we know there may be some long-term benefits of prebiotics for the prevention of atopic dermatitis or eczema and common infections in healthy infants. Probiotics are the actual friendly bacteria themselves. So lactobacillus, bifidobacterium, and Saccharomyces are a few of the most common as well as most studied bacterial strains that we find in probiotics for humans. Some research has shown that these probiotics may prevent or treat disorders that include infectious diarrhea, again, atopic dermatitis or eczema in children. Other possible benefits that are being other possible benefits are being studied as well. And that includes the possibility that probiotics may reduce the risk of food-related allergies, as well as asthma, prevent urinary tract infections, and improve or treat infantile colic. So hopefully more will come out on that soon.
You talked a little bit about foods earlier. Let's talk more in depth. Which foods in particular support healthy kids?
Great. So although getting your child to eat healthy, regardless of his or her age, can be a constant challenge, it is worth working creatively to meet their nutritional needs. A healthy child becomes a healthy adult, and only with your support and guidance will your child be both. Your child should consume a variety of foods from all 5 major food groups. Each food group supplies important nutrients, including vitamins and minerals. The more color, the better. So let's talk about some of those recommendations. We'll start with vegetables. The goal is 3 to 5 servings per day, and a serving may consist of 1 cup of raw leafy vegetables, 3/4 of a cup of vegetable juice, or a 1/2 cup of other vegetables chopped, raw, or cooked. When we talk about fruits, we want 2 to 4 servings per day, and a serving may consist of 1/2 of a cup of sliced fruit, 3/4 of a cup of juice, or a medium-sized whole fruit, like an apple, banana, or pear. Bread, cereal, and pasta are next. We want 6 to 11 servings per day in this group, and each serving should be equal to about a slice of bread, 1/2 cup of rice or pasta, or 1 ounce of cereal. Protein foods are next, with 2 to 3 servings of 2 to 3 ounces of cooked lean meat, poultry, or fish. That's about the size of a deck of cards. A serving in this group may also consist of 1/2 cup of cooked dried beans, 1 egg, or 2 tablespoons of peanut butter to replace each ounce of that lean meat. And finally, we have our dairy products with 2 to 3 servings per day of 1 cup of low-fat milk, yogurt, or 1 to 1.5 ounces of natural cheese. And remember, your infants need the whole fat milk for their brain development.
Excellent. And also you mentioned fiber a little bit earlier. Can you go into more detail about that, please?
Of course. So fiber is super important. It's an important nutrient that most children and their parents are not getting enough of each day. Fiber helps make us full. It also helps keep things moving in our digestive tract. A diet that includes good sources of fiber may help prevent constipation. These foods that are fiber containing are also good sources of nutrients and vitamins, and may help reduce the risk of heart disease and certain types of cancer and obesity. So how much fiber do children really need? There are different fiber recommendations for children based on their energy needs, age, and weight. And there are several different ways to think about it. So the first one is eat five, a simple way to make sure that your child or children are getting enough fiber and making healthy choices. So the goal would be to have them eat at least 5 servings of fruit and vegetables each day, along with the other foods that are a good source of fiber. So for kids that are good eaters, there's really not a reason for you to be counting fiber grams. The other way to think about fiber is add 5. If you find it helpful to keep track or your child is not the best eater, then you take 5 and add it to your child's age. An example would be a 5-year-old would need about 10 grams of fiber each day. It's also important to note that the total daily recommended amount of fiber for adults is 25 grams. And you can use that as a general guideline for your children also use it as the upper limit of not to pass, because too much fiber results in some complications like gas. So let's think about some good sources of fiber. Vegetables, fruit, beans, peas, nuts, and fiber-rich whole grain breads and cereal. Chia seeds are another great source of fiber, and 2 tablespoons of chia seeds have 10 grams of fiber.
Excellent. So half the battle is knowing what to feed our kids. The other half is getting them to actually eat it. What tips do you have to encourage them to eat fruits and vegetables in particular?
Great. So parents can support healthy eating habits by offering their children a lot of fruits and vegetables, creating a schedule for meals and snacks, and keeping healthy food in the home. Provide fruits and vegetables as snacks. Keep the fruit already washed, cut up, and in plain sight in the refrigerator, so it's one of the first things that they see, and hopefully one of the first things that they grab. Consider serving salads more often. Get pre-washed bagged salad at the grocery store, and teach your child what an appropriate amount of salad dressing is. So don't need lots and lots, just enough. And also remind them that when they order at restaurants, they can get that salad dressing on the side. You can try out vegetarian recipes for spaghetti, lasagna, chili, and other foods using vegetables instead of meat. And include at least 1 leafy green or yellow vegetable for vitamin A, such as spinach, broccoli, winter squash, greens, or carrots each day. Try to also include at least 1 vitamin C rich food, such as orange, grapefruit, strawberries, melons, tomatoes, and broccoli each day. Add a fruit or vegetable as part of every meal or snack and try to make it fun. So for example, you could put fruit on cereal, put a piece of fruit or a small salad with your child's lunch, use vegetables and dip for an after-school snack, add vegetables to the family's dinner. But I think most important is be a good role model and show your children that you enjoy eating fruits and vegetables, and do your best to encourage them to join you.
Excellent, because children do what they see you doing, right? So, so that is the end of our formal presentation. We've gotten a lot of questions both in advance and in the chat function. If you have any more questions, please go ahead and enter them into the chat now. And as a reminder, this recording will be posted in about a week. And so you'll be able to go back and watch it and listen to it again if you'd like to later. So let's go through some of the questions that we've gotten from our attendees. One came in just now, and it's about fruits and vegetables that we were talking about. If they're blended into a smoothie with only about, let's say, a 1/4 cup of Greek yogurt, does it still meet the fiber content if served that way?
Putting the fruits and vegetables into a blender doesn't harm their fiber content at all. And that's a great way to sneak in the fruits and vegetables and get the fiber into your kids. So that's one of the tricks that I use for my own kids, and use it as often as you can.
So another thing about fiber, are fiber supplements as good as the fiber found in food?
So the fiber that we find in whole foods, such as fruits and vegetables and whole grain breads, seeds, nuts, is the best fiber. However, for some of our children who are more selective, fiber supplements do allow us to meet the fiber goals that we have in order for them to have healthy intestines and a healthy microbiome. So while I would prefer that all children eat the fruits and vegetables and other fiber containing foods to meet their goal, I find that the children who aren't willing to eat or need to supplement to meet their goal and use fiber supplements have healthy intestines and a healthy microbiome. So working to find a balance and potentially using the fiber supplements to meet those goals is totally reasonable.
You mentioned that too much fiber is not necessarily a good thing because it can cause gas and bloating. What about, is there such a thing as too much prebiotic or probiotic?
I get that question a lot. So there isn't. What happens when we take prebiotics, the sugars that support the healthy bacteria, the bacteria consume the amount that they need to be healthy and robust, and the excess passes through in our poop. The same is true for probiotics. If we take too many probiotics, the extra bacteria don't have a place to attach to our intestinal wall. They don't get to join our microbiome, and we simply poop them out. So the biggest challenge of taking too much pre or probiotic is that you're paying the money to buy them. And so taking extra can be a waste of your money. So finding the right amount to support the microbiome and the intestines is the best thing to do. And that can be a little bit of trial and error, but it can definitely be done.
I like that, a waste of your money. I'm not sure if you intended that pun, but it was great. So speaking of poop, how much poop is enough poop? How much is not enough? How much is too much? How much should a typical child be pooping each day? And what to do if they're too frequent or too infrequent?
So let's talk about an average grade schooler, because that's typically when our poops change from our toddler to where we're going to be for the rest of our life. So our goal is, starting in grade school pretty much for the rest of our lives, that we have a bowel movement every day to every other day. And very rarely there are people that are healthy and stooling every 3 days. The goal is, the most important piece is that when people poop, it's soft, it's formed, it doesn't hurt, and there's no blood in it. We don't want kids spending too much time sitting on the toilet. In order to meet that goal, we can add some fiber and also make sure that they're getting in adequate fluids. So your pediatrician can help you understand what their fluid goals is. If that isn't working and we need to supplement with medications, we have many medications that have been proven to be safe and very effective. A couple examples would be Miralax, or a magnesium-based medicine like milk of magnesia or magnesium calm. All of these medicines can be titrated, so we can give more or less to meet that goal of soft bowel movements every day to every other day. It's also important to make sure that your children are taking the time to have a bowel movement. Oftentimes kids are having so much fun playing their games, running around outside, that they try to put off for too long having a good bowel movement, and that just makes their poops bigger, which can lead to some discomfort and some withholding. So make sure that they take the time at least 2 or 3 times a day to go sit on the toilet, and that when they're sitting on the toilet, their feet are on something solid. So I recommend a stool or old textbooks that the family's not using anymore, duct tape them together so that their feet are on something solid. That makes it a lot easier for kids to relax and let the poop come out. The final thing is, it's important to talk to your kids about how safe and comfortable they feel using the bathroom at school. Many of our children, including my own, don't like going to the bathroom at school, and so they hold it all day long, which can lead to some problems, particularly this time of year as we're returning to school. So make sure you have a plan that as soon as they get home, if they don't feel comfortable at school, as soon as they get home, they try after their snack to use the restroom. And hopefully you can establish a good pattern for them.
Excellent. So I also get questions from patients about infants. especially those who are breastfeeding, who may go days or even weeks without pooping. And the parents do get panicked about it. When do we need to be concerned?
Yeah, so infants are a totally different story, particularly breastfed infants. They can poop anywhere from 12 times a day to once every 5 days. And as long as they're still eating very well, they don't have a big distended stomach, and they're not uncomfortable, anywhere in that realm is considered normal. Um, that slowly transitions as we introduce solid foods. And then by 1 year, we do expect that they start pooping a little bit more frequently, so daily to every 3 days. And then by school age, it should be consistent every day to every 2, and again, very rarely every 3 days. But it is hard when they haven't pooped in 5 days. We all worry about that. But again, if they're eating and doing everything else they're supposed to be doing, no reason to worry.
Another question about infants. And you mentioned that the gut of humans pretty much develops in the first 1,000 days. So what if a baby only gets formula or gets any amount of formula in addition to breast milk? Will that harm or impact their gut in a negative way?
So we are incredibly lucky that formula has come a very long way, and formula now is a very reasonable replacement for breast milk. While we still feel that breast milk is best, there are certain situations where formula is needed, and that is 100% okay. It's safe for the baby. As we talked about, many formulas now have prebiotics, and some are even starting to add the probiotics to help establish that healthy gut microbiome. So we think that formula is safe, that it's not adversely impacting your baby, and that when you start their pureed foods, that's the time to really make sure that they're getting that good variety, which will make their microbiome even more robust. So whether you choose breast or formula, your baby will be healthy and well nourished if you continue to work with your pediatrician for that well-balanced diet.
You talked a little bit about babies and gas and probiotics. What about the use of other things such as gripe water, gas drops?
Yeah, so there's lots of products available in the stores to try to treat gas. Gripe water is a great example. So gripe water contains sodium bicarbonate, and herbs such as mint, ginger, chamomile, dill, fennel, and potentially lemon balm. Well, there's not a lot of evidence that gripe water actually helps with gas. There are a lot of families that feel that it does help. There are other over-the-counter products as well, anti-foaming things, anti-foaming chemicals called simethicone. That's the gas drops that you talked about. They also claim to help with the gassy babies, but like grape water, they haven't been proven to be effective. But also like grape water, there's a fair number of families that feel that they do see benefit. So while these haven't been shown to be effective, they've also not been shown to be harmful to your baby in any way. So they're certainly reasonable to try. You can also think about other non-medication options such as swaddling, shushing, little bit of vibration. These things can also help with the gas. And then thinking about the diet to see if there's anything in the diet that may be driving the gas. So many of us experience that broccoli and other things in our diet can impact our babies. So just paying attention to when the days of gas are the worst and what they've had in the last 24 hours may also be helpful.
Any input on the devices that people can use, the products that can go inside a baby's bottom to release any gas? Do you find that
there are little tubes that you can place into their bottom to help release the gas. Again, not a lot of evidence to show that that's the way, but have quite a few families that feel that they're helpful. If used appropriately and gently, they are not harmful. So something that you could consider trying.
Excellent. Another question about young children. You mentioned that the serving size for kids would be one slice of bread is considered a serving, or a deck of cards for meat is considered a serving. What about younger children, toddlers, preschoolers, etc.?
So everything is proportionately decreased by age. And your pediatrician can help you look at what traditional serving sizes are. And many pediatricians have great handouts that can help you understand, starting with under a year and then toddler, and it continues to grow until we reach those full goals.
Okay, another question is regarding antibiotics and gut health. You talked about some foods that we could give to give probiotics during a child's antibiotic course, such as for ear infection or strep throat. What is the role of probiotics either before, during, or after taking some antibiotics?
Yeah, so we know that antibiotics will have a significant impact on our microbiome, and we want to think about replenishing the microbiome after the antibiotic exposure. So we can do that either with some prebiotics, so the fiber-rich and other foods. We can do that with probiotics in the forms of the foods we talked about, with the yogurt and the fermented foods, or we can add a probiotic supplement, of which there are many available on the market. I generally recommend that families wait and not use the pre or probiotics until the antibiotics are done, because I believe that they're simply wasting money. The antibiotics will rapidly impact those healthy bacteria that we're providing. So on the last day of antibiotics, I recommend that the either pre or probiotics, whichever the family has selected, be started, and that those be continued for 2 to 4 weeks after to allow for the microbiome to recover. And oftentimes, if you're buying probiotics, they typically come in about a month's supply. So that's a reasonable option to use that.
Okay, another question is about milk and dairy products. I think it can be confusing for parents to understand allergies and intolerances. There are components of milk, such as milk protein or the milk sugar, lactose, that can cause trouble in children. Can you tell us a little bit about the difference? And if a child has one of those allergies or sensitivities, how can they get those important nutrients into their diet?
It's another great question. So cow's milk protein typically causes challenges earlier in life. So during infancy, either if they're on a cow's milk based formula or if mom drinks a lot of dairy, we may see that the baby has bloody diarrhea or lots of spitting up. Fortunately, lactose intolerance in infants is incredibly uncommon. There's only one population of Scandinavians that have a congenital lactase deficiency. So in the first year of life, it is typically more of a protein sensitivity or allergy, and the majority of children outgrow that. And so we do our best to avoid it for the first 9 months and then can introduce it. As we get a little bit later on in life, if we're not sure if it's the protein or the sugar, we have a couple of options. Children can be offered a lactate milk. So that has additional enzymes to help break down the lactose or the cow's milk sugar, or we can supplement the lactase enzyme. And if that helps with the symptoms, it's the sugar and not the protein. So we do have some ways that we can help to figure that out, but it's important to think about the age because, again, the lactose intolerance is incredibly unlikely before 1 or 2 years of life, and cow's milk intolerance is far more likely.
One question I got is about children who take medicine to treat reflux, and does that impact their gut flora?
It does. So the acid medicine impacts our gut flora and also impacts our ability to absorb some of our nutrients. If the child truly needs to be on it, the risk outweighs the benefits. However, the reduction in acid can create an environment in our intestines where some of the bacteria tend to grow more than others, and so it can impact that balance. When we stop the acid medicine, your body will rebalance and go back to the way that it is most optimally meant to be. And so again, when we need the medicine, we need it, but it does impact our microbiome and our absorption of some of our nutrients. As long as a child is having a truly well-balanced diet, it doesn't impact it enough for us to be too concerned. Although we do watch for bone health in children who have been on medicine for years and years and years, because we're finding that it can impact their ability to absorb all the nutrients they need for good bone health.
So speaking about bone health, and we mentioned dairy and calcium earlier, are supplements just as good as getting calcium from foods? Or should we try to find foods that the person's not sensitive to, such as maybe soy products?
Yeah, so again, we are so fortunate to be living when we do. We have so many milk alternatives and juice alternatives to cow's milk that are fortified with calcium and vitamin D for our bones. Similar to the fiber, finding adequate calcium and vitamin D in our foods is the best way. It's most likely to be absorbed well. However, if we have a really selective child, getting the calcium and vitamin D into them in a supplement is adequate. It just may not be absorbed as well as it is in the whole food. And so it's just important for us to watch to make sure that they're growing and developing the way that we expect.
So I've learned so much today, and I appreciate everyone's help in submitting questions, and Dr. Waasdorp. I think my favorite statistic was that the gut makes up 70% of your immune system, which I did not know. So thank you for that. And I will turn things over to our host and moderator right now.
Great. Well, thank you so much, Dr. Shu and Dr. Waasdorp. That was great information. We also want to take a moment to remind participants that if you go ahead and register on healthychildren.org, you'll receive our e-newsletter, a personalized homepage, and special offers. And don't forget to follow Healthy Children on Instagram, Facebook, Pinterest, and Twitter. We hope you enjoyed today's webinar. Please keep an eye out for a quick survey, and please let us know what you found most helpful and any suggestions you might have. And a big thank you to our sponsor for today's webinar, Go Go Squeeze. Thank you again, everyone. Have a great day.